अरे bipolar है क्या? Maybe you've heard the term used for many people who have certain mood related issues or who are moody or experience mood swings. But this colloquial use of this term is very different from the actual bipolar disorder. Good afternoon, my name is Mehezabin Dordi and I'm a clinical psychologist with the Sir H.M. Reliance Foundation Hospital, and in today's talk we're going to be talking about bipolar disorder. So what is bipolar disorder? The word bipolar means two extremes. For many millions experiencing this condition around the world, life is a split between two realities and two extremes, that is elation and depression. Bipolar disorder is a serious mental health condition that causes a person to experience dramatic shifts in their mood, in their overall emotions and energy levels, moving from extreme highs to extreme lows. Although there are many types of bipolar disorder, let's consider two. The type 1 involves extreme emotional highs and lows, whereas the type 2 involves much less extreme highs but a longer period of emotional lows that we also call as depression. Now, for any individual who is seesawing between these two emotional states, it can almost feel impossible to find a balance between this and to lead a healthy life. These extreme highs that we talk about are called as manic episodes, and that can make a person feel irritable to even invincible. However, these experiences of highs go beyond the expected ordinary feelings of joy, and which can also cause troubling symptoms such as racing thoughts, sleeplessness, rapid speech, impulsive actions, and risky behaviors. Without right treatments and interventions, these episodes can also become more frequent and intense and take longer to subside. The depressed phase of the bipolar disorder also manifests with certain variety of symptoms such as low mood, reduced interest in previously enjoyable tasks, feelings of worthlessness, guilt, changes in appetite, and irregular sleep. Occasionally, an individual might also feel suicidal or have suicidal thoughts. It is estimated that approximately 46 million people worldwide experience bipolar disorder in some form or the other. The studies show that 6 to 9% Indians suffer from bipolar disorder. However, most of these people are functional contributing members of the society, and their life choices and relationships are not impacted by the disorder. But still, for many individuals, the consequences can be very serious. This illness can undermine an individual's educational and professional performances, relationships, financial security, and even to the extent of personal safety. So the logical question remains, what causes bipolar disorder? Where does it come from? The exact cause of bipolar disorder is unknown, but several factors are involved, such as, firstly, biological differences. That is, people with bipolar disorders have known to have physical changes in their brains. Genetics also play a very important role here. Despite all of this though, this disorder is controllable. Certain medications have proven to be useful in helping an individual feel more in control of their life and manage their symptoms better. However, the treatment for bipolar disorder is not something that is one size that fits all. A combination of medicines and therapy can be utilized on a case-by-case basis to help an individual lead their life to the fullest of their potential. Beyond treatment, people with bipolar disorder can also benefit from simpler, smaller changes in their day-to-day life that may include, firstly, regular sleep, good amount of exercises, and sobriety from drugs and alcohols. Of course, not to mention that acceptance and empathy from friends and family goes a really long way. Good social support is essential and even crucial in helping an individual deal with bipolar disorder. It is important for all of us to remember at the end of the day that bipolar disorder is a concrete medical condition and it is not a person's fault. It doesn't come from a place of deficiency, but it is a medical condition that one needs to address. It does not define an individual, and it is a condition that can be very well controlled and managed with a combination of medications, therapy, self-work, and of course, social support. Thank you.